Hello, and welcome to the Truthology Abortion Special Part 3. I'm your host, Jeffrey Libby. No matter which side of the abortion debate you're on, in the words of Voltaire, if you wish to converse with me, define your terms. So today, we're going to learn about what this term abortion really means in practice. Is abortion a small, benign procedure like removing a mole or a wart? Or is it something far worse? You'll hear directly from abortion clinic doctors, abortion clinic staff, people who have been through abortions, and you'll even see for yourself with your own eyes via ultrasound imaging what's going on in these abortion procedures. So let's get right into it with the testimony of abortion doctor Anthony Levatino before the House Judiciary Committee. Watch this.
First witness is Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you, and use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.
Now, not all babies are ripped to shreds or vacuumed out of the womb, as Dr. Levatino just described. Oftentimes, the sac of fluid the baby is in is punctured or removed, and the baby comes out alive. Let's hear some former abortion clinic employees talk about how frequently this occurs and what happens to those babies who are born alive on a daily basis. Watch this.
I was an OR assistant. I did a lot of parts of the clinic, and one of my jobs was his right chair assistant. And I never paid attention. I did pay attention, but I didn't know that it was illegal. When he did an abortion, especially a over 20-week abortion, most of the time the fetus would come completely out before he either cut the spinal cord or he introduced one of the instruments into the soft spot of the fetus in order to kill the fetus. And but I wasn't aware. I thought, well, it's an abortion. That's what he does. But I wasn't aware that it was illegal. And on many occasions, we had fetus that he would use the process as far as what is it called, where he would dilate the cervix and then evacuate dilate the cervix, evacuate the uterus. And most of the time we would see him where the fetus would come completely out, and of course the fetus would still be alive because it was still moving, and you could see, of course, you could see the stomach breathing, and that's when he would do his, he would snip the spine, as they're saying, that this doctor did, and of course the soft spot was one of the spots that he would take one of the forceps, or the, what is it called, the dilators, and stick it down the soft spot of the fetus's head.
You saw this happen?
Oh yes, I think every morning I saw on several occasions. If we had 20-something patients, of course, maybe 10 or 12 or 13 or 15 patients would be large procedures, and out of those large procedures, I'm pretty sure I was seeing at least 3 to 4 fetus that were completely delivered in some way or another, because sometimes laminaria causes the cervix to get so soft that you don't need a lot of pulling or anything on it. Once you take that package out, 9 times out of 10, that fetus is ready kind of just to flow from inside of the uterus out into,
When you say package, you mean the laminaria?
the laminaria package insertion. Yes,
Right.
sir.
You take that out and the baby's ready to come out.
Yes, sir. As soon as that, or sometimes he would go ahead and bust the water sac, and there you go. You practically had a fetus, in the pan. So.
And you see the baby alive,
Yes, sir.
and him kill that baby outside the womb.
Yes, sir.
And this would be done by jamming some sort of instrument into the
Either that or
soft spot.
or actually twisting the head off the neck, kind of with his own bare hands.
And you saw that happen.
Yes, sir.
So he would twist
Sometimes
the
he
head
would
off.
go
I'm sorry.
through. Sometimes he would go through the stomach as well.
Sometimes he would do what?
He would force it through the stomach
The instrument, is it
and
beards?
twist it.
Yeah.
And you
Another
saw that?
Anything that he could get to the fastest. Like she said, the umbilical, he was probably perforating the umbilical cord. I normally saw either the snipping of the spine or the introduction of the instrument in the soft spot of the fetus, normally, or twisting of the neck.
I remember he would put his finger.
Yeah, or his finger. He'd take his finger and then
through the throat.
Yeah.
Now, what you saw described in those 2 clips is what's called a D&E, or dilation and extraction abortion. Yet another common technique is called a saline abortion. Sounds simple enough, right? Most of us, when we hear saline solution, we think about cleaning contact lenses. Well, let's take a moment to learn about the saline abortion process from someone who went through it herself, Melissa Oden. Watch this.
I think when most people hear about abortion survivors in our world, they automatically think of a woman and sometimes a man who has experienced an abortion in their life and, suffered consequences as a result of that. And what people don't often think about is that the word abortion survivor actually describes a group of people who survive their own abortions. And I know that because I'm one of them. I don't think people recognize, of course, when they first see me, that I suffered what I did when I was just an infant. My birth mother had a saline infusion abortion, and she thought she was less than 5 months pregnant when she went in to have that abortion. And what that actually entailed was a toxic salt solution being delivered into the amniotic fluid surrounding me in the womb. And the intent of that salt solution was to actually scald me to death. If people look up a saline infusion abortion in medical journals, or you look at it online, you'll read about how that toxic salt solution is meant to scald the child. It burns the skin, peels it away, moves internally into the organs to literally burn the child to death. And that type of procedure typically takes place over about 3 days. What I know in the case of my biological mother's abortion and my life is that I soaked in that toxic salt solution for 5 days. And I always tell people, I can't imagine what it was like for me to have to fight for my life in the womb. because what that procedure involves is literally the child fighting, the woman feeling the child thrashing about in the womb, fighting for their life. And so not only can I not imagine what it was like for me, but I can't imagine what it was like for my biological mother. You know, to have that salt solution delivered, to go home and wait for the sign that the life inside of her had been effectively snuffed out. And then to go back to the hospital on the 5th day and have her premature labor induced in the hopes that she would deliver a dead child that day. I can't imagine. But what I do know is that when she went back to the hospital on the 5th day at St. Luke's Hospital in Sioux City, Iowa, her labor was induced with me and I was delivered. And I was initially believed to be a successful abortion. From what my adoptive parents were told, they cast me aside, left me for dead in my mother's hospital room while they tended to her. They were going to dispose of me later. You know, I know this is my life. But sometimes I can't imagine what the beginning of my life was truly like. When I survived that day and I was initially left for dead and I was laid aside, God had other plans that day, and that's what brings me great joy, is to know that in spite of how I was left in that hospital room, God allowed me the opportunity to make weak grunting noises and tiny movements with my little body. And there was that nurse still tending to my biological mother, and that's when they realized that the abortion had not succeeded in ending my life. And that's when the medical procedures began that sustained my life. And I always tell people, I know looking at me, people can find that hard to imagine. But God does miraculous things every day, and I am just one small miracle that He's performed in this world. When I first survived, I weighed a little less than 3 pounds. I was 2 pounds, 14 ounces, which shows that my birth mother was much further along in her pregnancy than what she imagined. And one of the first notations by a doctor in my medical records that I now have, and I share publicly, because I want the world to see what God has done. You know, in those medical records, it says that I looked like I was almost 31 weeks gestational age. And it fits. It fits with how much I weighed and certainly how I had to fight for my life afterwards. I had severe respiratory and liver problems. I suffered from seizures for an extended period of time. If you see pictures of me as an infant, you'll see pictures of me lying in an incubator with my head shaved from temple to temple, because after they realized that I had survived, they started the IVs and they were run through my head to sustain me. I required multiple blood transfusions. And, you know, the doctors have made a couple things really clear. You know, first of all, there's no medical reason why I survived. I'm okay with that. You know, I believe in a much greater healer than someone who works in a hospital. You know, and I have nothing but the greatest respect for those doctors and nurses who provided me with medical care. You know, I owe them so much, but I know who the great healer is in my life. But the doctors also made it clear that there was no positive prognosis for my life at the time. When my adoptive parents were contacted by the social workers about this little girl who had survived a failed abortion, they were told that I probably wouldn't live for very long. And if I did live, I would suffer from multiple disabilities, ranging from being blind and deaf to having emotional and mental disabilities.
Guys, I implore you to be strong, have good courage, get past the trick of being on one team, one side, or one party. Look for yourself with clear eyes at what's really going on. Is tearing babies from their mother's wombs, limb from limb, burning living babies to death inside of their mothers, or delivering premature babies and then killing them or throwing them into the trash really what you support? Well, in addition to the techniques involved, sometimes people falsely equate whether the baby feels pain or not with the morality of killing it. Obviously, from a logical as well as a moral perspective, this is ridiculous because, by way of analogy, no one would ever say shooting an adult between the eyes is okay because they died without feeling any pain. Therefore, it makes no sense to use the excuse that it's okay to kill a baby because the baby didn't feel any pain. Nonetheless, let's look at the question of if babies suffer and feel pain during abortions or not. Supreme Court Justice Sotomayor says babies don't feel any pain. Let's take a listen in her own words.
The minority of people, a gross minority of doctors, who believe fetal pain exists before 24, 25 weeks. It's a huge minority, and one not well founded in science at all. So I don't see how that really adds anything to the discussion. That a small fringe of doctors believe that pain could be experienced before a cortex is formed doesn't mean that there's been that much of a difference since Casey.
Wow. At least she sure makes a good show of sounding confident to people who only listen to one side. But now, let's hear from former abortion clinic employees about their direct, personal, eyewitness experience of babies during abortion procedures and whether they feel pain or not. Watch this.
On some occasions, of course, he pulled out a lot of breech fetus, and their toes would be moving. You know, you can see the fetus toes moving. And as he would insert the forceps, what are they called? The beards. There's two types. There's the beards, and then there's the sophers. The beards are the ones with the bigger claws, and that's the one he would use to yank the fetus out. And I remember, I have a visual all the time. I always remember this. It's real disturbing to me, where he used to clamp, like push it in. He would hold the fetus by the feet and kind of pull down and insert the claws. And when he would squeeze them, you can see that baby's toes spread open. And I would always say, oh my goodness, you know, and people say that they don't feel. Well, if they didn't feel, why would their toes, their toes would be out hanging kind of like in a, what's going on, where am I going? And I remember clearly every time he used to use that instrument, I remember those little toes, opening wide. It was a sad picture. I normally would turn around, kind of just hold and, just turn around until he was finished.
Well, the only way to get more convincing than that eyewitness testimony would be to witness it for ourselves. And guess what? We can do that via ultrasound imaging. So let's now hear the story of a feminist abortion supporter who recorded her own abortion via ultrasound imaging. You will see with your own eyes how the baby is conscious, scared, and fighting for his life. Let's take a look.
We've seen what the 12-week child appears on the ultrasound screen. And we have also seen the mechanics, the actual steps of a 12-week abortion. Now, for the first time, we're going to see a film made with real-time ultrasound imaging of a 12-week abortion. Bear in mind that this is not an unusual instance, a late abortion. This is one of the 4,000 or so a day done every day in the United States. This film was made at an abortion clinic. The physician who performed the abortion was a young man who was working in 2 different abortion clinics at the time. He had already done close to 10,000 abortions in his young life. When he was asked to attend the editing session to view the film, he was so appalled at what he had done that he left the room momentarily, came back to finish the editing, but never again did another abortion. The young woman who used the real-time ultrasound camera was a feminist and a strong pro-abortionist, but she too was so moved by what she saw at the editing session that she never again discussed the subject of abortion. Now, let's turn to the actual film itself. We are now looking at a sector scan of a real-time ultrasound imaging of a 12-week unborn child. The child is orientated in this direction. You are looking now at the head of the child here, the body of the child here, and this image is the child's hand approaching its mouth. Looking a little more closely at the child, we can discern the eye, or the orbit of the eye, here, the nose of the child here, the mouth of the child here, and we can even look at the ventricle of the brain here. This is a fluid-filled space in the brain. We see the body of the child here with the ribs in silhouette and the spine of the child at the back. This rather granular area of tissue at the top of the sector appears to be the placenta, or afterbirth, of the child. And we can begin to see down here the thighs, the lower extremities of the child coming off the body in this manner. Now, let's move to the action. We now see the heart beating here in the child's chest. The heart is beating at a rate of approximately 140 a minute, and we can see the child moving rather serenely in the uterus. One can see it shifting position from time to time. It is still orientated in this manner, and the mouth is receiving the thumb of the child. The child again is moving quietly in its sanctuary. Now, this shadow which we are seeing down at the bottom of the screen is the suction tip. We have colored the suction tip deliberately in order for you to discern it more clearly. But the abortionist has now dilated the cervix and is now inserting this suction tip, which you can see moving back and forth across the screen. You will note that as the suction tip, which is now over here, moves toward the child will rear away from it and undergo much more violent, much more agitated movements. The child is now moving in a much more purposeful manner. Its orientation changes from time to time. It is rearing again here. Now, the suction tip has not actually touched the child, even though the child is extremely agitated and moving in a violent manner. The child has now moved back to the profile view, and the suction tip is flashing once again across the screen. The child's mouth is now open, and we will see that again on a freeze frame in a moment. But this suction tip, which you can see moving violently back and forth on the bottom of the screen, is the lethal instrument which will ultimately tear apart and destroy the child. It is only after the fluid has been broken, the sac has been disrupted, that the tip will actually come against the child. But we can see the tip moving back and forth as the abortionist seeks the child's body. Once again, we see the child's mouth wide open in a silent scream in this particular freeze frame. This is the silent scream of a child threatened imminently with extinction. Now the heart rate has speeded up dramatically, and the child's movements are violent at this point. It does sense aggression in its sanctuary. It is moving away. One can see it moving to the left side of the uterus in an attempt, a pathetic attempt, to escape the inexorable instruments which the abortionist is using to extinguish its life. Now, the heart has again perceptibly speeded up. We can time this at approximately 200 beats per minute. And there is no question this child senses the most mortal danger imaginable. The membrane has now been punctured and the fluid has escaped. One no longer sees that large reservoir of fluid surrounding the child. But once the fluid has been drained off, the suction tip has now been firmly clamped to the child's body, and the child is being pulled in a downward direction by the abortionist's suction tip with the negative pressure applied to it, and the body is now being torn systematically from the head. The head of the child being in this direction here. I am now outlining the child's head. The lower extremities have already been lost, and we see the suction tip flashing from time to time in the screen as a typhoon-like series of echoes, and the child is being tugged back and forth as the suction tip has now been applied to the body, and the abortionist is exerting his traction on the child in this manner. The child's head is still discernible here. The body is no longer discernible. It has now been torn from the head. What we see now is the head itself with what is called the midline echo of the head and the spicules or fragments of bone. Now this head, which I'm outlining here, on this 12-week child is simply too large to be pulled in one piece out of the uterus. The abortionist is going to have to employ this instrument, the polyp forceps, in an attempt to grab the head. The abortionist will attempt to crush the head with this instrument in this manner and remove the head piecemeal from the uterus. The abortionist and the anesthesiologist have a secret language between them which shields them from the grisly reality of what is going on. The abortionist and the anesthesiologist together refer to the head of this child, which is now being sought, as number one. And the anesthesiologist will inquire of the abortionist, is number one out yet? Are we finished? We now see intermittently the shanks or blades of this instrument appearing in the image here. The head tends to float freely in the uterus. Here are the shanks or blades of the instrument coming across here. And the head is now being locked on by this polyp forceps, and the head is being pulled down toward the cervix. Now all we see remaining are simply the shards, the broken fragments, the pieces of tissue which document that there was once a living, defenseless, tiny human being here.
I don't know what more can be said after that, but I'll leave you with a quote. The cultural environment for a human holocaust is present whenever any society can be misled into defining individuals as less than human and therefore devoid of value and respect, end quote. We must see and acknowledge what's really going on and stand up to stop this Holocaust, period. This is the most important issue of our generation. Do you think that's an overstatement or an exaggeration? If so, let's look at some numbers of human deaths resulting from major wars for comparison. The Revolutionary War, 25,000 deaths. Civil War, 500,000 deaths. World War I, 116,000 deaths. World War II, 545,000 deaths. The Korean War, 54,000 deaths. The Vietnam War, 56,000 deaths. All 6 major wars combined, 1,296,000 deaths. Those 1 million killed are like nothing compared to the deaths from abortion. 1 in 5 pregnancies worldwide ends in abortion. An estimated 50 million abortions are carried out throughout the world each year, and more than 1.5 billion babies have been aborted worldwide in the past 50 years. In talking about all these death statistics, it's important to face up to the fact that we're all going to die. So how can we know with certainty what's going to happen to us after we die? We can know from the design of the universe all the way down to the design of every single cell of every living thing that there is a creator, as we learned about on episodes 2 through 5. And that there is historical proof of Jesus' physical resurrection from the dead, as we talked about on episodes 6 through 12. And finally, we know that the Bible is objectively, historically, prophetically, provably the divinely inspired Word of God, as we saw in episodes 13 through 16 of this series. God, Jesus, and the Bible are the 3 keys to knowing what will happen after you die. And I hope that you will all consider each of them deeply as you consider this issue of abortion. Now, I know many of you still think that somehow, in some way, these abortions are helping women, making their life better, giving them health care, and so on. But in reality, nothing could be further from the truth. So in the next section, we'll shift from looking at abortions in relation to the baby to instead looking at them through the eyes of the mother. We will see if these women are receiving health care or if they're yet another victim of this horrible atrocity called abortion. I'll see you there.